This is a good question from Corey. It says, do you think your tenure as a forensic pathologist would make you a good family practitioner based on all that you've seen? Family practitioners and pathologists are similar in that both have to have a very wide range of clinical knowledge. Because family practitioners are going to be seen with every symptom in the book, and they have to come up with a differential diagnosis of what those could be. Likewise, as pathologists, whether you're surgical or forensic or whatever, our whole thing is differential diagnosis. Whether we're seeing the tissue or we're hearing a symptom, we automatically think of that. So the mindset in that sense is a little bit similar. But let me tell a real brief story on why I did not go into primary care or become a family practitioner, for instance. So I had a family practice rotation as a third-year medical student, as is required by the medical school. And it was an outpatient clinic where, we didn't go into the hospital and round on patients. We just went to a clinic, okay? The doctor that I worked with was a nice guy, but he was a broken man. I mean, he was downtrodden. He was exhausted. He was obese, and I'm not saying that as an insult. I mean, he told me that he had gained like 80 or 90 or 100 pounds since starting because of how hard he worked and how little he got to have time to himself. He was physically very tired from his busy clinic, but he was also mentally tired, and let me tell you why. One day he told me, and he wasn't trying to sway me either way. I was just there to learn and see patients and stuff like that. But he told me that his job is mentally exhausting because almost every person that comes in has a treatable condition. And when he recommends a treatment that doesn't involve a pill, they get mad, and then they say, and his quote was, "Doc, just give me a pill." So I find that important to point out because so often we hear about people sort of denigrating doctors and saying that all doctors just want to push pills and expensive treatments on people. But there are doctors out there who want to do it try to avoid medication as much as possible. And this guy was going out of his way for every patient, and they were doing what doctors are accused of. In other words, give me pills. So they were demanding, and I'm not talking about like drug seeking and give me opioids, but I mean like if somebody comes in and their blood sugar's running a little high, he may say, "Hey, why don't you try to lose 10 pounds and walk a mile or two a day?" And that would make them very angry. So, I could go on and on about that. But the point is, I learned in that experience that maybe this wasn't the career for me because I like to produce a solution for, the patient and hope that they follow it. Well, as a pathologist, my solution is the diagnosis. I don't really have a role in whether or not they follow it. I'm a surgical pathologist as well as a forensic pathologist. So my diagnosis is kind of the final word, and then the doctors and the patients take it from there. Would I have made a good family practitioner? It possibly. I mean, on one hand, my mind works, and many pathologists work this way, where when we are presented with a symptom or a clue, we automatically have a complete algorithm of all the differential diagnosis that it could be. So for a patient to come in with some odd symptoms, we're thinking of the worst possible thing it could be and trying to rule that out. So in that way, I think it would be good. But on the other hand, family practitioners have a lot of face-to-face, hand-to-hand, hand-holding time with the patient, and that's good. And there are doctors that should be doing that. But I don't know that I would have sustained in that field for very long. Pathologists have a reputation of not wanting to talk to people or be with people, but I always got compliments for my bedside manner when I was in medical school. So, I clearly can talk to people. It's just emotionally and mentally and physically, could I have sustained that career for as long as I did as a pathologist? And I would say the answer to that is probably no.